Hey everybody. All right, so this is the welcome video. I'm sorry if it wasn't working, but so I shot another one. So 2421 is strictly HIM 2421 is strictly going over ICD-10-CM codes, which is diagnosis codes. That is the medical necessity on a visit or procedures or services that are being done. So with that, hopefully you have your 2023 book. Um, um, this is mine. I'm not sure that you have. Well, that's not showing very well. Okay, so I'm not sure. Let me take off my backdrop because this is really blurry. Um, uh, Okay, there we go. That's better. Okay. Well, now you see my Nebraska wall. Okay, so this book here, ICD-10 2010, is what the ones we're going to be working on this quarter. Purchase it. You have to have the 2023 if you're going to sit for the CPC exam, and guard it with your life because they're very expensive and you don't want to damage it and have to buy another one. Okay, you will be using it in the next class too as well. So we will be using it quite a bit for the next 10, 20, or the next 20 plus weeks. And then when we get into the prep, if you're taking it. So this reads like a phone book. So it's alphabetized from A to Z, and it's based on the main term of the diagnosis. So the main term is basically what's wrong. So headache, disorder, disease, hematuria, the descriptors are what you look for after you look for the main term. So that is like acquired, congenital, acute, chronic, manifested. So that's the thing we're looking at. So if you'll, in your book, if you will look under, let's go to pneumonia. So PNEU is where you're going in the book. Okay. And make sure you're in pneumonia and not pneumonitis. Okay. Because they look a little alike, but yet they're different. Okay. So pneumonia, if you can see, it starts on my book, it starts on page 264 and it goes all the way over to page 265. There's like so many codes. So the main code is the pneumonia code of J18.9, which is listed with pneumonia right there. The boldface is your main term. Okay. So, but if I wanted acute pneumonia, then I would look down and see if I could find acute down there. There is no acute, but if I look in the parentheses next to pneumonia, I see that acute is listed there. So acute is part of the pneumonia main term. Okay. If I wanted chronic, then I would look pneumonia and I would look down and look for C's and I would find chronic. Okay. And I do believe we do not have a chronic. Okay. Probably because chronic pneumonia isn't something that's consistently people have all the time. Chronic tends to be something like asthma, where you have it and then it kind of goes away, but it comes back, but it's always initially there because you always have that indication that you're going to get it. Those are for the consistently people who always have that underlying asthma. So let's go to asthma, for example, since we're talking about it in the office section. Okay, and if you notice on my book, it starts with page 33 and it goes over to page 34. And it's about a column and just a little bit on the top in the middle there. So if I wanted to look for chronic asthma, then you look down and find chronic, and chronic should be your code of J44.9. But you can get more extensive than that. If you look under chronic asthma, you can also look to see, do you have the indicators to have acute lower respiratory infection or exacerbation? A lot of times they'll say non-exacerbation or exacerbation. Exacerbation means you would have to code that J44.9 code, but if it's non, then you don't have to worry about it. You just code the chronic obstructive J44.9. Okay. Once you get done looking at your code in the front of the book, then you go to the back of the book where the number sections are. And the number sections start with the color code back there on the side of the page. If you notice, the very first color on my book is like green, okay, on the very side here. And that's where the number section or the tab section starts. Okay, so if you wanted to look for J44.9, we'd have to go to the J's, and all of the numbers and are actually located at the top of the page. So it kind of helps you out in the top right-hand corner. So you can flip through it fairly easy. So we went J44.9. J's are actually yellow. Okay. J44.9 in my book is on page 714 in the back, and it says chronic obstructive pulmonary disease unspecified. Now, this is where we verify our code to make sure that we have all of our characters. Now, this one has no markings in front of it to say it needs more characters, so we're good, okay? But if you look over to the next page, let's look at J45.2. J45.2 is mild intermittent asthma, okay? Next to that code, J45.2 states that you're supposed to have 5 characters, which means you can't code that J45.2. You have to code either the 0.20, 21, or 22. So you have to pick within those numbers on which one you really are coding for. If you code just the 4 characters, it's incorrect. Okay, it's wrong, and you're going to get errored out when you code this in the real world because you did not code it to the full extent. Okay, now sometimes you might have to go look for a box for your last codes. Let me see if I can find one in the M section, because M is usually a culprit that has the boxes. But sometimes in this tab section, I'm not seeing any M's in here. I don't have it. No boxes. Let's try S. Okay, well, OB-GYN has it, but I don't want to do the OB-GYN because that's too confusing right now. So let's do S and see if we can find it under strains and things of that sort. So, okay, page 995 in the back of the book, and look for SO2, fracture and skull of facial bone, SO2, okay? SO2 in front of the code says it's supposed to have 4 characters, so you can't code the SO2, you have to look down, okay? SO2.0, if that was the code you wanted, it says in front of it, you need to have 7. So this is where when you talk about in your reading and you read that the placeholders is where you're going to start putting X's on the fill to get to your 7th character. Okay, so in the box it says that you have to use one of the codes in the box, in the pink box above it, and you have to use it in the 7th character. So you do 70 or SO2.0, that gives you 4, and then you're going to have to go XX, which gives you 6. And then you put one of those alphas on the backside. So if it was a closed fracture, then you put A for initial closed fracture, or B, if you're looking for an open fracture, initial encounter for open fracture, B. So you would have that SO2.0, XX, A, or B, or if it comes down to any of the other ones that are in that box. Okay. So find a way to write this down in your notebook if you have a 3-ring binder or a spiral notebook about how to do this. So never code from the front of the book 100%. You always have to find your code and then go to the tab section, find it, and look very carefully for those boxes in front of the code to tell you how many characters you need to have. Okay. Now, that's how we use the book. Now, I want to go through some of the things that are in the book, okay? Different sections. So if you go to history in the alpha section, okay, so history is broken down from family and personal. So it starts off history, and you notice right under history, and it's on my page of 176 in the alpha. It's going to be close, okay? So 176 underneath it says family. So that's everything that has to do with family history. That doesn't have to do with the patient. It has to do with their family members. Okay. And then when you get down to family history down to, I think it's focal. Okay, visual loss. Okay, which in my book is page 177. And it's up at the very top of the middle. It's of the middle column. It says visual loss Z82.1. That ends the family history. Now, if you want to put a line there so that way you know where family and then personal starts, that's perfect. So anything underneath there is personal history. Okay, so that has to do with the patient. Okay, one we're going to be doing a lot of is malignancies when we get into when we get into the area of neoplasms and things like that. So history, personal, and if you want to go down to malignant, which is actually on the next page, on page 178, you will see personal, history, malignant, and then you have to find what type it is. Malignant means positive cancer. Okay, so malignant is any body part there. Breast is one of them. Okay, actually, it does start over here on the neck at the previous column towards the end there. Neoplasm breast is Z85.3. Now, I want you to remember, write this down. History means that it is not current. Okay. So if a physician says patient has a family or a history of diabetes, that is a current condition. So it is not a history. So you do not look in history. You actually look in diabetes. Okay. So be very careful. It's a process of thinking. Think about what you're coding for. If patients, once they have diabetes, they very rarely ever get away from diabetes. And if they're on medication, they have diabetes. Okay. So if it's a family history, usually you're not going to see family history of diabetes can be in there because it doesn't relate to the patient itself. But personal history, you're going to see a lot of things such as the malignancies, for example, again, intestinal problems, things of that sort. But again, it's all things that are past tense in remission, not current now. Okay. So that's the history section. Next, we have the neoplasm section. In my book, it's okay. So right after the alpha section, there is a darker gray side here where it starts on the side tab. That's where it starts the neoplasms, and mine's on page 342 was where it starts. Okay. Now, I'll probably go through this again on another video later when we get to neoplasms, but it looks confusing, but it really isn't. So basic bottom line, there's a lot of different cancers you can have. You can have a malignancy of a primary, which means it's the primary site, did not move anywhere else. This is where it started. Okay. The second column here is malignancy secondary, which means that's the metastasized site or the site of which that cancer traveled to. Okay. The third column is cancer in situ. The fourth one is benign. Okay. And then the other ones are uncertain behavior and unspecified. Uncertain means they're questioning it as far as whether it's malignant or benign or whether it's moving. And uncertain means that they don't know if it is or isn't. Now, you want to use that as a last resort because nobody wants to know if a yes, no answer is a maybe. Okay. And insurance wants to know yes, no, and not maybe. Okay. So keep that in mind. So the way you do this is you go to the neoplasm table and then you look for the body system. Okay. So if you're looking for cancer of the bone, okay, well, these are alphabetized again. But be very careful because the headers tell you on each of the top of the columns where you're at, because it does get into things like, there is connective tissue, skin. Now, neoplasms are usually skin. So you want to go to skin first. So let's find skin in here. And be very careful with your headers to make sure you're not in anything else or like subcutaneous tissue. We just want to go to skin. Okay. Okay, I found skin there. So let me see if I can find it here. Okay, skin starts on my page of 355 in the back in my alpha section. And it's down on the second column of main terms at skin. And then we're going to go down, say it was breast. Okay, so breast is way down at the end of that column. And if it's a primary, lesions are usually always primary because every lesion is separate. Okay, so if it's a breast, it depends on what kind of cancer it is. If you can cancer it, you can code as basal cell carcinoma if it's a basal cell, which is really great because that tells you exactly what it is. Or if it's just a malignant lesion, then you'd have to use that C44.501, the first column for malignancy primary. But if it's a basal cell, then you would use the C44.511. If it's another type, then you would use the C44.591. Squamous cells in there, C44.521. And then we go into other body areas. Okay. So you have to be very careful. Now, when would we use the secondary is if that's our focus. So if we're focusing on a metastasized site, then we would use this one first. If they give us a primary, then we use that second. Okay. If we don't know where the primary is, they say this is metastasized site, primary site unknown. Okay, that's the tricky one. And you want to write this down. Okay. We go back to the very first page of the neoplasm table where it started, which is on page 342. And you use that very first code in the malignancy column of which is C80.1, which is neoplasm neoplastic. C80.1. So if it's ever stated primary site unknown, you would use that C80.1. Okay. All right. So that's how we use the neoplasm. And again, we'll probably talk about it again when we get closer into that. The next section is a lighter gray area on the sides, and that is the drugs and table, the drug table. And this is for any medications. And a lot of times we use this because there is a side effect or something that's going on that we need to tell the story, because this all diagnoses are storytelling. Okay. So if we were looking for, let's look for Tylenol. Okay. They're alphabetized. So we're going to go to the T's in here. Okay. And I bet Tylenol is probably not in here. It's probably the generic form. Yeah, I don't see it. Okay, so let's look for um um trying to think of a drug that's commonly used. Okay, let's try Bactrim. Let's go back to the B's. Okay, we're gonna go back quite a bit because Bactrim, always good for antibiotics. Okay. All right. Okay. So Bactrim. I should probably turn my light on. It's a little dark in here. Okay. All right. I'm not having any luck on Bactrim either. Okay. Let's try penicillin. Okay, penicillin page. Oh my gosh. Let's see. lift the page up here, 396. And okay, so if it's penicillin, the first column is poison accident. So if they accidentally took penicillin, you would use that code there. And then you go to the back of the book and you would actually finish your code. I'm going to say that again. Every time you look up a code, you go to the back of the book and finish the code. Okay. So if it's an accident, it's the first column. If it's a poisoning, intentional self-harm, if they did it on purpose, then you would use that code and then finish it off in the back of the book. If somebody gave it to them, that's called an assault. So you would use that code. And then poisoning, undetermined, if you do not know, you use that column. And then adverse effect, if they had a side effect of the penicillin, you would use that code. And then the other one, underdosing, if they gave you penicillin as a prescription and you're not taking it correctly, and if you got problems, then you would use that code for underdosing. So underdosing means that the patient was given the right prescription, but they're not taking it the way they're supposed to take it, and they're not taking it enough. And this happens, the reason why this column is in here is because a lot of patients, sometimes because of finances, reduced their load of what they take for their drugs in order to make it last longer because they can't afford to get the prescription filled so soon. So if they're underdosing and they're having problems, that would be the code that you're using. Okay, so there's the table of drugs. And then after that, then we have a table here, a section for accidents, or this is where we use these a lot for accidents, ED visits, things of that sort. Sometimes in the clinical setting too, if they come to clinic instead of going to the ED, fractures, all kinds of stuff. But this first section is accident, and you're going to see there's a ton of them. And this has a lot to do with accidents such as transport. So it could be pedestrian, it could be on a bicycle, it could be a car, it could be a truck, it could be a semi, a bus, things of that sort. So that's what's in the accident section there in the front. And then if you get further back, you can get into watercraft and things like that. This is a very tricky section to use because you really kind of have to do some looking, because there's just so many accidents that are in here based on whether that's transportation, pedestrian, or transportation in general. Okay. And then activity, and we use this to say what the patient was doing at the time they got hurt. Okay. So, and then after activity, then we get into what happened to them, because we want to say and tell the story of, first we're going to have the diagnosis code from the front of the book, and then we're going to verify it in the back. So if it's a fracture, for example, say a little boy was in the park riding his bike and he fell off and broke his femur, and it's an open fractured femur. So first you would code for the open fractured femur, and then you would probably do accident, transport, pedestrian type thing to get to bicycle. Okay. I don't know. Let's go to fall here in this section. I think falling is probably going to be basically in the front. From off of, I don't think bike's going to be on here, because I think bike is going to be, it's going to be in the accident section. And then you're going to do the activity code of what they were doing, riding a bike. Okay. And then you're going to do place of occurrence. So you're going to go to the P's for place of occurrence in here to say where it was. And since I told you it was in the park, all you have to do is go to place of occurrence and find park. Okay. Which place of occurrence? I would look at 441. And then you're going to look down and see if you can find park somewhere. Place of occurrence. I have to go over to 440. Let's see if we can find park. Okay, park public, Y92.830. Again, you want to go to the back of the book and finish the code. Okay, look for those little red blue boxes and stuff to make sure you have all of your letters and characters. Okay, so that's place of occurrence usually goes last. Okay, and then that's pretty much the sections of the book. for ICD-10-CM. So let me know if you have any other questions, but that's basically a rundown of what you need to do in order to code, to use the book. Okay. Don't try and rush your homework. Please use time management skills and work on it a little every day, because there's reading that's involved in it. Plus you have to actually concentrate on what you're coding for and pick out all of those words of which they're telling you in that scenario in order to make the code to the fullest extent. Okay. Again, if you have any questions, let me know, email me. Okay. Have a great week. Thanks.